Finance Minister Nirmala Sitharaman announced a series of major healthcare measures in Union Budget 2026
to provide relief to patients, particularly those suffering from cancer. I propose to exempt basic customs duty on 17 drugs or medicines. I propose also to add 7 more rare diseases for the purposes of exempting import duties on personal imports of drugs, medicines, and food for special medical purposes used in their treatment.
with a focus on cancer care, rare diseases, and strengthening medical infrastructure across the country. As immediate relief for patients, the Finance Minister announced the exemption of basic customs duty on 17 essential cancer drugs and medicines. She also said 7 more rare diseases have been added to the list eligible for import duty exemption on personal imports of medicines and special medical foods. Laying out a broader healthcare roadmap, the Finance Minister unveiled a large-scale plan to strengthen India's health system over the next 5 years. She said 1 lakh allied health professionals and 1.5 lakh caregivers will be trained to meet growing healthcare demands. She announced the launch of NIMHANS 2 to expand mental health services and research. She also said district hospitals across the country will increase capacity by 50%, supported by new emergency and trauma care centers. To promote specialized and holistic care, Sitharaman announced the creation of 5 regional medical hubs and 3 new All India Institutes of Ayurveda. The Finance Minister said these measures aim to make healthcare in India more modern, accessible, and specialized while reducing the cost burden on patients and strengthening capacity at all levels. In another move, Sitharaman said the limit for duty-free imports of specified inputs used in seafood processing for exports has been increased from 1% to 3% of the previous year's export turnover. She also announced that duty-free imports earlier allowed for leather and synthetic footwear exports will now be extended to shoe uppers as well.